Good morning, good afternoon, and welcome to our press briefing here at WHO Europe, coming to you from our brand new studio here in Copenhagen, Denmark. My name is Banu Patnagar. I'm the Press and Media Relations Officer here at WHO Europe. Just a word on physical distancing. All of us gathered here in the studio are physically distanced, and indeed here at UN City we observe physical distancing, and if we cannot, we do wear our masks. Before handing over to the Regional Director, Dr Hans Kluge, to make his opening remarks, let me introduce our in-house experts who are also ready to respond to your questions. Joining us here in the studio, we have Dr. Gerald Rockenschaub, our new Regional Emergency Director. And joining us online, we have Dr. Oleg Benesh, Vaccines Technical Officer at WHO Europe. He joins us from Copenhagen. And joining us from Tbilisi in Georgia to take your questions on cancer, Ms. Alison Ekberg, WHO Europe's Health Policy Advisor. So, without further delay, Hans, Regional Director, you have the floor.
The European region has recorded 12 million new cases in the past week. This is the highest weekly case incidence since the start of the pandemic and is largely being driven by the highly transmissible Omicron variant, as it sweeps from west to east. 30% of all COVID-19 cases since the pandemic began have been reported this year alone. We now have nearly 150 million reported cases of COVID-19 in Europe and Central Asia to date. 22% of all tests recorded are positive. Hospitalizations continue to rise, mainly in countries with lower vaccination uptake in vulnerable populations. This rise, however, is not as rapid as the case incidence rate, and overall, admissions to intensive care have not increased significantly. For now, the number of deaths across the region is starting to plateau. I wish to reiterate the firm call I made last week, which is indeed referring to a plausible endgame for the pandemic. Not to say that it is now all over, but to highlight that in the European region there is a singular opportunity to take control of the transmission because of the congruence of three elements. First, a large capital of vaccine-derived and natural immunity by Omicron. Second, a favorable seasonality pause as we move out of the winter. And third, a lower severity of the Omicron variant, now well established. This context that we have not experienced so far in this pandemic leaves us with the possibility for a long period of tranquility and a much higher level of population defense against any resurge in transmission, even with a more virulent variant. This period of higher protection should be seen as a ceasefire that could bring us enduring peace, on the condition that we, 1. Consolidate and preserve immunity by keeping vaccinating and boosting. 2. Focus on the 5 stabilizers for the most vulnerable with strong governmental oversight and commitment. 3. Promote self-protecting behavior and individual responsibility, here with lower governmental oversight to limit unnecessary socio-economic impact. 4. Intensify surveillance to detect new variants. I believe that it is possible to respond to new variants that will inevitably emerge without reinstalling the kind of disruptive measures we needed before. And it is because we see that opportunity that the top priority is to bring all countries to a level of protection which allows them to grasp this opportunity too, and look ahead towards more stable days. But this demands a drastic and uncompromising increase in vaccine sharing across borders. We cannot accept vaccine inequity for one more day. Vaccines must be for everyone, in the remotest corner of our vast region and beyond. Tomorrow is World Cancer Day, and I want to take the opportunity to underscore the catastrophic impact the pandemic has had over the past 2 years on people with cancer. The impact of COVID-19 indeed goes far beyond the disease itself. Cancer touches all our lives, either directly or through its effect on family and loved ones. 1 in 4 people in Europe and Central Asia will receive a cancer diagnosis in their lifetime. It is one of the leading causes of mortality and morbidity in the WHO European region, accounting for more than 20% of all deaths. Looking back over these past 2 years, cancer screening, diagnosis and treatment have suffered in an unprecedented way as health services have struggled to respond to COVID-19. Consider this: during the early stages of the pandemic, the diagnosis of invasive tumors fell by 44% in Belgium. In Italy, colorectal screenings decreased by 46% between 2019 and 2020. In Spain, the number of cancers diagnosed in 2020 was 34% lower than expected. The latest Global Pulse survey conducted by WHO on the continuity of essential health services during the COVID-19 pandemic indicates that in the last quarter of 2021, there was a disruption in cancer care, screening and treatment of between 5 to 50% in all countries reporting. The situation has improved since the first quarter of last year, where services were disrupted by more than 50% in 44% of countries, and by between 5 to 50% in the rest. But the knock-on effect of this disruption will be felt for years. 44% of countries around the world reported an increase in service backlogs for cancer screening in the second half of 2021. The way in which the pandemic delays cancer care and creates service backlogs is a deadly interplay. At this point in time, 24 months since COVID-19's arrival, the health workforce is overstretched and exhausted, repurposed to address the direct impact of the virus. But any respite that widespread immunity provides thanks to vaccination and in the wake of the less severe Omicron, together with the coming spring and summer season, must be used immediately to enable health workers to return to other important healthcare functions in order to bring backlogs for chronic care services down. As we go forwards, maintenance of essential health services, including services along the continuum of cancer care, from prevention, early detection, diagnosis, treatment and palliative care, must be a component of emergency planning and response. World Cancer Day tomorrow is a timely reminder that 30 to 40% of cancers in Europe and Central Asia are preventable. To mark the day, we are publishing a new guide on cancer screening, summarizing evidence and ethics, addressing misconceptions. This is part of an initiative we introduced a year ago, United Action Against Cancer, a commitment by WHO to fast-track the elimination of cancer as a life-threatening disease in Europe and Central Asia, through cost-effective, evidence-based policies at every point of cancer care. From where we stand now, as we see cases surge across Europe and Central Asia, we remain at a critical juncture. But I remain optimistic that if we use the circumstances before us, we do have the opportunity to experience more stable days ahead, a time when we be able to not only manage COVID-19, but will also have the capacity to address other urgent health priorities. Now I'm very happy to introduce Aron Andersen, who is WHO Europe's Cancer Ambassador and a driving force in our initiative United Action Against Cancer.
My name is Aron Andersen. I was first diagnosed with cancer when I was 7 years old. And since then I've had cancer 4 times. I've undergone 11 surgeries, and I'm here today living my life as a professional adventurer and motivational speaker. This World Cancer Day marks the 1-year anniversary of the launch of the United Action Against Cancer initiative in Europe and Central Asia. And this aims to eliminate cancer as a life-threatening disease. So yeah, we are aiming high. For a world where cancer is no longer a disease people die from, but one that can be diagnosed and treated in time. I was lucky. My cancer was discovered early on, within a few weeks, and I had access to treatment and continuous follow-up with excellent professionals. And I could decide early on to make the most out of my life. Others are not as lucky. I think my story illustrates the importance of early diagnosis, because I actually had a friend who was diagnosed with the same kind of cancer as I had, but that diagnosis took about a year. Mine took a few weeks. And if she would have been diagnosed right away, she might have been alive today. Instead, she died just 17 years old. Since I know from my own experience that not all cancers are preventable, it is important that the new cancers and new cases are detected early. And this is, of course, often a question of resources. As cancer ambassador for the WHO, I'm learning more all the time. I've learned how important it is for countries to first focus on strengthening their early diagnosis before considering starting a cancer screening program. And I've learned that it's not a good approach to just screen as much as possible. I now know that there are 3 types of cancer, 3 types of cancer screening programs that are recommended. We have cervical cancer screening programs, we have breast cancer screening programs, and colorectal cancer screening programs. But screening is not enough. It's vital that a full treatment pathway is offered. As you may know, yesterday the WHO Europe published a short guide on cancer screening. It will be a big help to policymakers in making decisions about screening programs. And we know that COVID has disrupted services. People were not diagnosed and treated in time. And so we foresee a huge increase in cases. And my hope for the region is that people will have the same access to quality services as I was fortunate enough to have. And that cancer will no longer stop people from living the life they dream of. Thank you.
Inspirational words there from a really inspirational man. Thank you so much, Aron. So on that, let's move to those journalists calling in and move to questions. And we also have some questions we've received in advance, which I will also go to in due course. But let's begin with Nikolaus Skusgard from Reuters. Nikolai, please do unmute yourself. And if we can see you, that would be great as well.
Yes, hello everyone. Good morning, or that's the time of the day. First of all, I wanted to get your thoughts on the use of antiviral pills. Can you tell whether they are actually helping on hospitalization or death statistics? And secondly, on the Omicron subvariant BA2, are you able to provide any more data than you provided, was it earlier this week or last week, on this subvariant? Thank you.
Thanks, Nikolai. We'll go straight to our new regional emergency director, Dr. Rockenschaub, for both of those. So on the antivirals and on this new sublineage of Omicron.
Yeah, thanks very much, Nikolai. Very interesting question. I mean, what we do see is these new antivirals are certainly very promising new tools in our toolkit to combat the pandemic. But we need to put things in perspective. First of all, it's only one that is at the moment receiving EMA registration, which is Paxlovid. It also needs, have a sophisticated setup in the health system, because those antivirals need to be, administered very early to have appropriate effects. But what we know is they drastically reduce the risk for more severe diseases. But they also need to target very specific patient groups, which are people who are at high risk of severe disease. On the BA2 variant, we know that it is increasingly spreading. We have recorded cases now from 57 countries as of yesterday globally. We're very carefully monitoring that. It seems to be more transmissible. It seems to have also a similar effect on severity as the BA1 subvariant, but further studies are really needed to fully come to a conclusion in that respect. Thanks.
Thank you.
Thank you very much, Dr. Rockenschaub. I'm going to go take a question that we received in advance specifically on cancer. So we'll be going to our cancer expert next. The question we received from TASS, the Russian news agency. We know that cancer screening has suffered because of the pandemic, but how bad is it exactly in the European region? And what will be the medium to long-term impacts? And what should governments be doing? So Alison, over to you, please.
Thank you very much. As Dr. Kluge mentioned, the COVID-19 pandemic has caused disruptions and backlogs in cancer screening, diagnosis, and treatment across the region. The pulse survey that he mentioned shows that all healthcare settings and service delivery platforms were affected, particularly first contact services. And the latest round shows that this has actually increased. So these disruptions lead to later stage disease, greater treatment costs, and excess mortality. He mentioned some data, but some additional points I'd like to mention is that the Time to Act Data Navigator shows that in Poland, the number of mammography tests performed in April to May of 2020 fell by 94% as compared to 2019. In France, there are an estimated 200 backlog days in chemotherapy services. In Romania, 77.5% of patients had difficulties attending required medical services during the COVID pandemic. But the impact extends beyond the clinical aspects, and we must also consider the non-medical factors, the social determinants of health, and that's the conditions in which we're born, we grow, we work, and we live. The COVID-19 pandemic has contributed to an increase in inequalities, and the poor segments of society have shown the lowest screening uptake and the highest diagnosis following emergency presentation. So COVID restrictions have also influenced cancer-related risk factors and also alcohol consumption and obesity. And so the question, what can governments do? So first, ensure continuation of essential cancer treatment, diagnosis, and screening for those cancers for which screening is recommended. As we heard, that's breast, cervical, and colorectal. And this is especially for high-risk populations. And where screening programs are not in place or where they're not recommended for certain cancers, and where health systems are less resilient, further investment is needed more than ever in health system strengthening, in primary healthcare to improve early diagnosis, and also in cancer pathways to link the patient from screening, and also in primary healthcare to improve early diagnosis, as well as in cancer pathways to link all the way through from early diagnosis, screening, and to treatment. But it's not just enough to screen people. We also have to recognize the impact of the pandemic on vulnerable populations and increase efforts to reach these populations by rethinking how governments collaborate with vulnerable communities to develop more inclusive services. And then finally, governments can implement policies that improve access to essential health services, as well as economic and social policies that address the root causes of ill health and better enable populations to reduce their risk and live healthy lives. So we want to also mention that on a positive note, we should acknowledge the innovations born of necessity during this time and evaluate which of these should be continued and expanded to close the care gap and to ensure we leave no one behind. Thank you.
Thank you so much, Alison. Moving on, we've been getting a recurring question from some media. Regional Director, I'll be going to you for this one next. We've received a similar question from AFP, from Associated Press as well, as also from Xinhua, with regards to the lifting of restrictions in several countries, including here in Denmark, over the past week or so. What is WHO's position on the lifting of these restrictions? And for countries that are lifting those restrictions, what should they be keeping an eye on? Regional Director.
Thank you, Manu. So first to remind that we have a very vast region, and what we see is a west to east tidal wave. So there's quite some diversity. Ultimately, it's a decision by the country itself based on weighing risk towards benefits. But it's absolutely true that we are at crossroads 2 years since the first COVID-19 case. In fact, the strategy shifts from minimizing transmission to minimizing disruption because of the very fast spread of the Omicron variant. The key point is to shield the vulnerable. First with respirators, we know that they're much more effective than the surgical masks. By further doing whatever it takes to increase the vaccination uptake, including the third dose or the so-called booster. And we see a shift from strategy from governments to responsibilizing the individuals. Self-testing, self-quarantining, so the society to take care of themselves. At the same time, the governments to invest in strong surveillance, like is happening, for example, in the country which is hosting our regional office, Denmark, which has opened up, so to ensure that very quickly you can pick up a variant and monitor the situation. Further, as was mentioned by one of the colleagues, to increase the access to the new antivirus, taking into account the caveats that Dr. Rockenshoop was mentioning. And finally, be ready if there is a new wave, again, first and foremost, to shield the vulnerable by physical distancing and taking the mask. So the pandemic is not over, but we are in a unique situation, as I was telling, to take control, and we should not waste this opportunity.
Thank you very much, Regional Director. Let's go to questions coming in live. Let's go to Jeremy from Radio France. Jeremy, please do unmute yourself and ask your question.
Thank you so much. I'd like to come back to the word that you used, plausible endgame. It seems that Dr. Tedros in Geneva advised against using that term a couple of days ago. I'd like to know if there's any discrepancy between what you're thinking and what WHO Geneva is thinking.
Thank you, Jeremy. Regional Director, please, floor is yours.
Thank you. So very important clarification. There is absolutely no contradiction over there. So WHO Geneva is obviously speaking about a global perspective. We here in the European region have a unique situation. First and foremost, that once the Omicron wave will subside, there will be a large capital of immunity, be it thanks to the vaccine or due to the infection. I mean, the continent has, in general, quite high vaccination and booster rates, number one. Number two, seasonality is decreasing. And the third one, we know that Omicron, now that's quite well established, is milder, particularly in the vaccinated and the boosted people. So the pandemic is not over, as Dr. Tedros is rightly telling so, but the point that Dr. Tedros is making, that we in the European region have been supporting from day one, is the need for international global solidarity. If 2021 was the year of vaccine production, let 2022 be the year of vaccine equity. And if the countries and the individuals are taking the opportunity now to implement those measures I was mentioning a minute ago, it should be possible to avoid going back to the pandemic era restrictions. And the question is not only what will happen if there is a new variant of SARS-CoV-2, the question more and more should be, what if tomorrow there is another virus? Is the world better prepared to tackle that pandemic?
Thank you very much, Regional Director. I'd like to bring in our vaccines expert to hear from Dr. Benes as well. Oleg, it'd be good if we could give us a little update on vaccine uptake and coverage across the region. And also, there's another question we're getting a lot from media with regards to the vaccine effectiveness vis-a-vis Omicron, and especially vis-a-vis the new lineage, the BA.2. So the floor is yours, Dr. Benes.
Thank you for this important question. So as Regional Director has mentioned, we have a unique situation with COVID vaccine uptake in European region. In general, the uptake with the first dose is about 66%, and about 60% of population has received the second dose. Of course, there is an important variation across the geographical areas and income areas in the region. When we look at uptake in high-income countries, they are much ahead. So we are speaking about 71% getting fully vaccinated. We are speaking about very high percentage of vulnerable groups, older adults being vaccinated. And also we are speaking about almost 40% getting already booster doses. Now, that is not the case in lower middle income countries, where we still are quite low with full vaccination uptake. Only 1/3, 1 in 3 people have received a full vaccination course. Booster doses are just starting to roll out, so there is much to do here. And most important, which I would like to highlight, and also highlighted by the Regional Director, is that only 1 in 3 older adults got protected by vaccination in low middle income countries. So there is much to do in order to protect most vulnerable in this group of countries from hospitalizations, from severe disease and outcomes. Now, moving to the second question on the vaccine effectiveness against Omicron. First of all, we could really see, and data already clearly show that the vaccine effectiveness against transmission wanes in time for other variants, such as Delta, and is even considerably lower for Omicron. So vaccines have a very limited impact on preventing transmission of Omicron. However, the good news is that the currently vaccines which are currently authorized by WHO for emergency use listing remain very effective in preventing severe disease and serious outcomes. So they are important in preventing hospitalizations and protecting health systems. They work well on preventing deaths. That's very important. Therefore, it's important to continue vaccination. And we can see this effect on an important impact on severe outcomes across all ages. So it's not just in older adults, but even in younger adults and children as well. I hope I answered this question.
Thank you. Thank you very much, Dr. Benesch. You certainly did. Let's go to questions coming in. Gunilla von Hall from Svenska Dagbladet, please unmute yourself and ask your question.
Yes, thank you for taking my question. It concerns COVID vaccination for the age group 5 to 11. Countries are choosing different paths here. Sweden, for example, is not recommending it. And I would like to have your view a little bit. What is the need for vaccination in this age group? What is the importance to actually offer the possibility for parents to choose? And would you have some data on the vaccination rate in this age group?
Thank you, Gunilla. I think I'm going to go straight to our vaccines expert once again on this. Dr. Benesch, please, the floor is yours.
Yeah, thanks so much for this question. On January 21st, the Strategic Advisory Group of Experts on Immunization has updated recommendations to countries, the roadmap of using COVID vaccines. And when we look at this roadmap, we can see that the way of prioritizing vaccination follows the strategy to reduce severe outcomes. Children, and even children from 5 to 11, those with chronic conditions, they are in a higher priority to get the vaccines because the benefit of vaccination will be much higher. Healthy children are in the lowest priority group because we know that the disease in general is milder in children. At the same time, it's important to keep in mind that also rare but serious, severe disease and serious outcomes may also happen in children. Here I'm thinking about multi-inflammatory syndrome in children. We know that also some of affected children may develop myocarditis. We know about the long COVID. So countries which have taken the decisions to vaccinate this group of children, definitely they looked at data and risks which children from this group are facing. And again, prioritizing this group should be made in the context of the achieved uptake in other priority groups as well. So definitely the knowledge on new variants is evolving, and countries are continuously updating the existing knowledge on both risks and benefits. Therefore, it's an ongoing discussion on it. But again, as I said, WHO recommends vaccinating children. However, they are not in the high priority, except those children with comorbidities.
Thank you, Dr. Benesch, for that comprehensive answer. So let's go now to Tom Magner from Carers World. Tom, please unmute yourself and ask your question.
Good morning, everybody. My question really bridges both COVID-19 and cancer and other types of conditions that are indirectly affected by the COVID-19. Dr. Kluge, you quite rightly referred to shielding the vulnerable. But one of the unintended consequences of all of the measures for COVID-19 has been that many of unpaid carers and the people they care for fear going out of their homes or letting support services in. What's your best advice to address that sort of, in effect, long-term personal family lockdown type of situation? Thank you.
Regional Director, would you like to, or sorry, I meant to go to Alison actually. Alison, would you like to address that question with regards to sort of family lockdown, personal lockdowns for carers of vulnerable people when it comes to COVID, the interplay between COVID and cancer?
Sure, thank you for that question. And of course, we need to recognize the extreme pressures this has put on caregivers, professional caregivers, at-home caregivers, and that's where the recommendations for prevention come into play, and to follow the recommendations of WHO with masking and social distancing to the extent that that's available. But we have to also recognize the mental health stress that this is creating, both for those providing care and for those receiving care, in addition to COVID, in addition to cancer. So this is where I think, we also look to governments to put in place policies to help better support those types of services. And I recognize the incredible stress that this creates, and try to find balance. But I think, there's also associations, support groups can also play a role here. And I think that's important in maintaining mental health. I hope that helps.
Thank you, Alison. And Regional Director, would you like to add anything there?
Yes, maybe Banu, because the question was kindly was reaching out to me. So confirming what Alison was telling, and to reassure that we pay a lot of attention to the informal carers. In fact, we are going to go to our next governing board meeting in Tel Aviv in September. It's called the Regional Committee, with a report of the status of health workforce in the WHO European region, which will include the informal carers. And I'm very happy that Alison finished her intervention with mentioning the mental health. Because as many of you know, mental health is a flagship priority for this office over here. And we pay also a lot of attention to the mental health of the informal carers, who include, as many people don't know, also many young people who already are impacted by mental health and then also have an additional burden. So I really appreciate your question. Thank you.
Thank you very much, Regional Director. I think we have a follow-up question from Nikolai at Reuters. Nikolai?
Yes, thanks for taking just one more question. This follows up on a previous question on vaccines for young kids. Do you, and if this answers the same, I'm sorry, but do you have any thoughts on the US right now prepping to review Pfizer's vaccine for young kids, very young kids under 5 years of age? Yeah, that was it. Is it too soon?
Thank you. Oleg, Dr. Benesch, would you like to take that one?
Yeah. Definitely, we have yet to see the data in terms of effectiveness and safety of a new product. In general, definitely, we need to be well prepared both for responding to the current threats, but also to be prepared for the future as well. Having a product for across or products across age groups, it's good that we have tools and we would have capacity to deploy it if needed. Virus is evolving. We really need to keep our guard high, and in case a new variant emerges, which will put younger children at risk, it's definitely great to have a product ready to provide it to children.
Thank you very much, Dr. Benesch. So on that, if there are no further questions, I'm going to close this press briefing for today. I'd like to thank the Regional Director. Thank you very much also to our panelists, Dr. Benesch, Ms. Ekberg, and Dr. Rockenschab here in the studio, and of course, Mr. Anderson for his intervention on cancer. If you need any additional follow-up or you have any follow-up questions that you might think of a little bit later, please do email us using the details provided in the invitation. And as always, stay healthy, take care, goodbye.